Thank you very much. I think we heard all week that the policies are there. The challenge is really around operationalising them. Concern is actually a very practical, very grounded organisation, and I think my brief today is really to share with you some lessons and promising practice that might help those of you who are trying to operationalise this concept of resilience. I'm basing my presentation on a randomised controlled trial design that we have done with Tufts University in Eastern Chad. And there are kind of two key elements to it. One is the long-term development interventions, so asset building across a range of multi-sectoral interventions. And alongside that is the ability to have early warning and early action. So you've got these two things happening at the same time. I think that's critical. So if you bear with me, that's kind of the design I'm basing some of the discussions on. So I'm going to actually talk about four things. One, I'm going to talk a little bit about sectoral integration, because if you're talking about multi-sectoral interventions, the issue of getting ministries to work together is a critical one. The second thing I'm going to talk about is a surge model, which is actually helping health systems to cope with epidemic spikes in terms of malnutrition. The third thing I'm going to talk about is a community resilience indexing system that we've been piloting. And the last thing, I'm just going to share a couple of lessons on capacity building, institutional strengthening, particularly those relevant to community resilience. So the first thing I want to talk about, as I said, is resilience through integrated programming. We're working with IFPRI, again, on a randomised controlled trial in Zambia. It's not a resilience program, it's actually a program to prevent stunting. But it's called Realigning Agriculture to Improve Nutrition. We all know that challenge, getting agricultural ministries not to focus on productivity but on nutritional outcomes. And, it's actually going quite well, but one of the real challenges there is to actually get ministries to behave and act in different ways. I think we're doing some interesting things there. We've had Scott Drimmy, who used to work for IFPRI in Southern Africa, helping us from a sociological point of view about change management with ministries. We decided that we would set up, basically, we looked at district as the key entry point. We set up a district coordination committee around nutrition, and we have basically got the Ministries of Health and Agriculture to work much more closely together. It's actually working very well. Some would say that the Sun Lead group have been bringing people down there to see it. I mean, obviously it's premised on the fact that there's a lot of leadership with the Sun movement in Zambia already. But I think it's really important that we attack or address that challenge of integrating ministries for a common purpose. And again, while that common purpose is nutrition or to address stunting, I think we're going to face the same dilemma in trying to build resilience. The second thing I want to talk about is the surge model. I mean, most of us, I think, who are involved in health work are involved in health system strengthening. It's a long-term process, we know that. But of course, what happens is, and particularly in areas like, say, northern Kenya, is you do get these epidemic spikes of malnutrition when you do have a drought. And, the problem is for the front line, the health clinics, is that these caseloads spike up, but they don't have the capacity to do so. So we have designed this surge model, which is basically a way of being able to track. So what it has is, it's got 5 components. One is risk analysis. So what's the predominant risk, and what will drive the spikes in terms of caseloads at clinic level? Basically, you set thresholds, you monitor against those thresholds in terms of caseload, and they trigger surge support. So then Concern, for example, goes into the clinics, and we provide them with extra assistance in terms of perhaps drugs, could be ready-to-use therapeutic food, could be staffing, etc., etc. Provide this surge support for the duration of the crisis, and then we scale down the surge support. So there will be different levels of support required depending on the severity of the crisis, but this would all be done in advance and in an MOU between supporting organisations and the health ministry. I think what's important in terms of our discussions around food and nutrition security is, I think this surge capacity model is also probably very applicable to veterinary services. So the third thing I want to talk about is what we call the community resilience indexing system. We had, I think, it's a very interesting session yesterday on measurement, and we know the challenge and the complexity of the measurement of resilience. We're not going to crack it. We're a small organisation, a very grounded one. But while we're waiting for the technical group to come up with the larger measures and the sentinel sites and the high frequency surveys and all of that, we're looking at actually how do we measure it on the ground at kind of local group, local CBO, local NGO or local government level. And so, this indexing system is designed to be to measure to what degree communities are resilient. So depending on a number of characteristics, and these characteristics we actually base on the sustainable livelihoods frameworks. So in fact what we do is we're looking at a whole range of assets and asset classes. So we're talking about looking at physical, natural, financial, human, social, the classic assets that are in the DFID Sustainable Livelihoods Framework, but we also added political. We also have indicators which capture the enabling environment, which I think is really important, particularly around disaster risk management. So apart from asset building, there's a whole lens on it which is around disaster risk management. We're actually looking at how this kind of a system, which can be used very much at community and local level, can contribute to the wider measurement debate. But I think at a very minimum, it is actually an excellent capacity assessment tool where communities, local groups, local government can actually assess their own resilience. It is premised on the assumption, of course, that these are the components of resilience and that needs to be tested. And we will look at that in due course. But I think it's a very practical way of measuring resilience. And I think, again, it's like any index where it actually starts a discussion. And communities and those can look at a whole range of factors and say, actually, you know what? This is where we're weak. We really need to put some plans into action on that. So that's the Community Resilience Indexing System. So the last thing really I want to talk about is just a couple of lessons around capacity building in local institutions. And this is a hard one for me to pin down, so just bear with me a little. We were struck by the fact that our local partners in Pakistan, Bangladesh and Orissa in India were development organisations, local NGOs doing long-term development interventions, but they had the capacity and the mindset to respond to emergencies and to be able to do so effectively. I was very struck in Gujarat, with the Gujarat earthquake, that the local NGOs there actually didn't have the capacities to respond because it was a shock. On the east of India, obviously, there are regular cyclones, etc. So they're actually used to that idea of chronic vulnerability, regular occurring crises. But with the one in Gujarat, it was very interesting talking with the development NGOs. They said, actually, we don't know how to respond to emergencies. We want to, we don't have the capacity. And they're asking us to say, the simplest way you can help us is actually just send us one person who would just help us lead the emergency response and who has the skills to do it. But what I think is interesting, and the lesson I think we learned from our Pakistan colleagues in particular, is that they have both the mindset of long-term interventions and the humanitarian impulse. But they also have the skill sets to be able to move back and forth between the two. And this is something that has bedeviled us as an international NGO for years. Our humanitarian people say, oh, you development people, you're actually not interested in responding to emergencies. And this has been a kind of it's one of the silos we're trying to break down. And it's actually one of the things that's led us to focus on fragile states, because we're going to work now in actually these areas where there are recurring crises. And we're going to try and form and build a much more coherent and consistent skill base and mindset around the movement between the two. So I think that's important. I think just in terms of capacity building, I think the frequency of dealing with cases or with shocks builds expertise. And I think, I know in the Irish health system, for example, we talk about clinical work, that people build expertise by doing the same surgical procedures more and more and more. If they're only doing it very rarely, they actually don't build expertise. I think there's a very interesting study by Trinity College in Dublin on mid-level providers in Malawi, where there are a whole cadre of health staff who are actually not trained at doctor level, but effectively working at that level. And part of the rationale is they've actually been doing things very frequently. And it's quite an interesting story. I think for us, just in terms of capacity building, things that work are basically, I think training, we know, training on its own is a waste of time. People learn by doing. They learn, I think, most capacity building interventions really around accompaniment, support, coaching, being close to people, and being very practical initially. I think getting various actors like CBOs, local NGOs, government working together and getting that synergy working is really critical. Leadership is critical, but be very careful. And I think this came up a number of times already. Don't focus on individuals. Focus on teams and cadres. Organizations lose capacity when one individual goes if you focus on that individual. So you just need to be careful about that. I think at the grassroots, we just need to be very practical first, because, when we're talking about grassroots groups and institutions of the poor, they want to see tangible results. When they see tangible results, it builds trust, and then you become more strategic and you get more done. So I think relationships matter, trust building matters. The big thing, I think, though, is that capacity building is a slow, steady investment, and that's what we need to be doing. Maybe my favourite little phrase at the moment, I was going to put up a picture of a rugby team, but I'll come back to that, is it's a quotation from a French nun called Le Mère Angélique, and she says, perfection consists not in doing extraordinary things, but doing ordinary things extraordinarily well. So it's around capacity, is around concerted commitment, building it up and staying the course. I think that would be my key message. Thank you.